I was really, really lost because I hadn't ever heard of such before. So I seized the opportunity to upload the knowledge to my hard drive, if you know what I mean. Years later, I asked the grown-ups around me why these solutions were not applied in my childhood. Good is expensive, and that's why they don't do it. But if you go make research, you find out that these things are not expensive. It's just ignorance. So when I realized that many medical solutions should have been taken, were ruled out to be really expensive, regardless of the actual cost. And really, it doesn't hurt to ask. Today, like you would have guessed, we are talking about tetanus. Is it dangerous? Should it be taken seriously? Well, you'll find out really soon. I am not a doctor, but I have one with me. I'm referring to Dr. Okafor Emmanuel, the Chief Medical Director of JSP Marks Diagnostic Center, Lagos, and also the Medical Director of Val Martins International Medical Services. We're going to be right back. Don't go away. Don't touch that dial. We're going to talk about tetanus. What do you have to know about tetanus? Everything will be downloaded for you, and you can choose to upload it or not. And the topic for today is tetanus. Remember, I said I am with Dr. Okafor Emmanuel, who is going to provide us with the requisite information on this topic. He'll be also bursting some myths on tetanus for us. Okay, good morning, Doc.
Good morning, Lillian.
How are you doing today?
I'm doing good.
I'm fine. I'm fine as Nigeria will allow me.
Actually,
It's a crazy word out there, really.
yeah.
Okay, so let's just dive into it, quickly. I want to know what tetanus is. Many people have been hearing tetanus. They have no idea what it is.
Okay. Thank you very much. Thank you, Lagos. Thank you, Nigerians. I'm happy to be here again today. Tetanus. It's a common. It's a common parlance that people use. It's a medical problem, and as simple as it sounds, it's a serious medical condition, a serious bacterial infection that affects the nervous system.
Okay.
And what it does is that it causes the muscle throughout the body to tighten. That is the layman definition. When we talk about the nervous system, they are classified into central and peripheral nervous system. Central nervous system. Its resultant effect is that it's generally a lockjaw disease in the jaw. There are several muscles there. It causes these muscles to contract jaw muscle. Most of them cannot be able to open the mouth, cannot be able to chew, cannot be able to masticate. It can eventually spread to other parts of the body. It is a life-threatening medical condition. As simple as it sounds, it can lead to a medical emergency.
So before we talk about what happens after one gets it, let us talk about ways that one can get
by a bacteria called Clostridium tetani. That is the name of the bacterial infection, a small prion microorganism. So tetanus is is a bacterial infection, unlike viral infection. So what happens could be found on the dust. They attach on the ducts, attach on the dirt, and droppings of animals. So it is always in the environment.
Okay.
So because this Clostridium tetani is everywhere, so when they produce the spore is just like is in the air that have where they could attach to substances around the environment. So they're often resistant to harsh climate or harsh weather, in the sense that irrespective of the sun, they can survive on the sun, they can survive in cold weather, in humid environment. So when a person gets infected with this Clostridium organism, the spore is always transported through the bloodstream. So it means if you have a wound, it enters the wound carries it because there's a blood supply to that part of the wound. The blood carries it into the central nervous system. Majorly, it could enter through the brain or could enter through the spinal cord. And as it enters it blocks transmission. So every nerve that supplies the body, the muscles, all of them gets input from the central nervous system, which is the spinal cord. Once this spore gets into the central nervous system, the spinal cord, they obliterate supply. What does it mean? The muscles will no more get impulses, will no more get electric supply. So It's just like if you want to test wire and you bridge a wire, you don't get current anymore.
Yes.
So they normally produce, this is medical, there's a substance they produce, call it tetanus plasmin. So this is what's attached on the nerve or the wire of the body, stopping the information from getting from the central nervous system to muscles. So once muscles are no more getting information, they get stiff.
Okay.
So one of the sources where we get these things could be from crush wound. If an individual has wound, a crush wound, maybe a motor accident, or fall from a height, a building collapse, or a fight, or machete cut. So there could be injuries from dead tissues, burns. An individual could get burnt, and that burn is not properly managed. The spores of the Clostridium tetanus could attach on the wound from the burn. So it could be stepping on the nail. When you were doing your introduction, you talked about a child that stepped on the nail. So an individual could step on the nail because nail is always in the environment. A dirty nail, the spore of this organism could stick on the nail, and an individual could step on the nail, and the spores transmit into the bloodstream. So there could be wound contamination by feces. These are less common. Feces could transmit because insects are always in the environment. These spores could attach on the insect, and one insect could get infected. So other places could be dental prompting or licking hands or doing something. These spores could get into wound that have stayed for so long, not healing and all that. From person to person, it is very important.
Okay.
Meaning, if I have me in the hospital, you will not get it.
Okay.
Because it's not what we inhale as the spore.
Okay, it's getting tricky right now.
Yes, so it's contaminated way, lost way of getting it, the contaminated saliva and all that. So it occurs worldwide. It is very in the sub-Saharan and tropical region.
All right, we've talked about what tetanus is and how it can be contracted. And it's important that if someone has it and sneezes near you, you won't get it.
No.
Okay. So you mentioned that it is called a lockjaw.
Yes.
So does that mean that is the only symptom you get when one has tetanus?
Yeah. It's normally the first sign, the prodrome.
Okay.
So in the sense that if these are one of the first symptoms it shows,
okay,
such individual always have difficulty in swallowing because the muscles of the neck, the muscles of chewing, they cannot chew, they cannot even open their mouth. If you're a doctor and you've been in the hospital to manage a patient with tetanus, you see as they are coming, cannot open the mouth because they always clench. It's always clenched.
Is it related to TMJ?
Yes.
It is?
Yes. TMJ, temporomandibular joint.
Yes.
Are you getting so all the muscles, temporomandibular joints here?
Yes.
Are you getting it? There are muscles that control them. So there are muscles of mastication. So what happens is that the nerve that supplies electricity to those muscles are obliterated, and they can no longer move. So they get contracted, permanently contracted, unless something is done.
So is it something that happens gradually or just instantly?
No, it's something that happens gradually. However, it has an incubation period.
Okay.
It's always 3 to 21 days. If an individual gets infected today, it might take up to the next 3 days to produce symptom, to develop symptom. I mean, it takes 21 days for an individual to have symptom, meaning the incubation period between the time of individual getting infected with Clostridium tetani or tetanus to the time of development of clinical symptom, what we call the incubation period, is between 3 to 21 days. Meaning it could happen on the 3rd day, it could happen on 4th day, 5th day to 21 days. However, it might be more than that 21 days. I get it. But most time it's between this period.
Okay. We're still talking about symptoms.
Yes. So majorly the symptom is always a lockjaw. The muscles of the body get stiff. If you have seen an individual, it does not only the lockjaw we are talking about is because this is always the first place.
Okay.
Because from the brain, it's always a craniocaudal problem. So it moves up, down. For you know, the individual will not be able to move the limbs because the limbs are also, the muscles
Get
of the limb are stiff. You find out that it may, if not properly tackled, it may affect the muscles of respiration.
Okay.
Individual may not be able to breathe very well because all the muscles, all the nerve supply to the body are always affected. So the individual normally symptomatically they may be having difficulty in breathing, difficulty in swallowing, their blood pressure may be high, they may have pain in the abdomen, they may have pain in the chest, they may have pain all over their body. But one thing is this individual most time, and it is a very fatal disease. It kills, but it does not kill fast, meaning such individual, it debilitates those individuals before killing them. So they can have respiratory failure. Secondly, one of the first signs they have is difficulty in swallowing.
Okay.
Because they cannot open their mouth, they cannot swallow. So imagine an individual who is sick and cannot swallow, cannot open the mouth. Even if you give him food, he cannot swallow unless you have to put an engine to.
Is it equally fatal in kids as it is in adults, or it's more fatal in kids?
Yes, kids don't get this disease because when tetanus vaccines have been integrated into the immunization schedule.
Oh, okay.
So you hardly see kids just having it.
Okay.
So
this brings us to the treatment options. How is it treated?
okay.
By the way, if you have any questions on this, 0410 0913 6000410. You can send an SMS or WhatsApp message, or you can call that number. So let's go into treatment options.
Okay. The treatment depends on the severity of the disease. Once they develop clinical symptoms, so most times we give admit them to a particular time. So we give them tetanus immunoglobulin to neutralize the tetanus plasmin, the toxin they produce. There's an immunoglobulin laxant that will relax the spasticity of the muscle. So muscle relaxation. If they have wounds, I'll call it debridement. Cut off some dirty parts of the wound. Once they have this wound, start treating the wound to make sure the wound heals fast.
Okay.
So we may also give the vaccine to an individual that has already developed. We give that individual the tetanus vaccine. So it slows the progression and has been shown to trigger the symptom. Because when you see an individual, normally have they only have a
Okay, this might be unrelated, but is that why whenever you're watching any of this
oh yes, like there are some individuals with that have seizure problem. Though maybe unrelated now because this is what happens at the central nervous system.
Okay.
Light could be source of trigger of seizure to some individual. Once they stay in the light, in fact, once you flashlight, the spasticity start or program of the disease start immediately.
Really, so that you can be aware of your health.
So another form of treatment, when they admit in respiration, they're always stiff and all that. So you give them oxygen to aid their respiration. So keep them in the dark room. Oxygen is very, very important because most of them might have developed pneumonia during this period. Problem. If you are managing a tetanus patient now, and you play any song, any music there, the symptom triggers. So their protocol of managing those patients, but majorly is antibiotic treatment to kill the bacteria organism, to kill the bacteria that's causing it. And medicine need to be feeding or will be giving IV infusion if the individual cannot be intubated. Thank you.
All right, let's go on a break. Let's take a breather. We'll be right back because I have a very serious claim. Manuel, we're talking about tetanus and what you should know about it. I've learned a lot so far, and there's still much to learn. especially for you to be aware of your health. And we are also live on Facebook right now and on YouTube concerning this or any other thing that you might be worried about concerning your health. 091-36000410. We're talking about tetanus, causes, symptoms, treatment. You talked about vaccination. I lost a nail.
Okay.
It's pulled off. It was the craziest time. And I had the tetanus shot. I've had it before. I want to know, that tetanus shot...
Yes, but.
There's a but there.
Yes. Now, the one an individual is given at birth contain about 3 to 5 vaccines. MPHI, National Program on Immunization. Instead of giving children vaccines 1-1, so they've synthesized the vaccines and combined them in one.
Okay.
Merge them that individual could be given. So we call it DPT, diphtheria. So when a child is born, so at a particular age, a particular weeks, so that child is given DPT, diphtheria, pertussis, and tetanus. We call it DPT. So now, but once you have an injury, especially when you are above 11 to 12 years, because tetanus vaccine is expected to wane off after 10 years.
Okay.
Meaning, the time you had your nail, when your nail pulled off or pulled out, you got a vaccine. That is the vaccine. Now, between that period to now, if it's not more than 10 years, it's still effective.
Okay, so that was the vaccine I got.
Yes.
1 second, let us take the score. Hello?
Hello.
Yeah, good morning. Your name and location, please.
Yeah, my name is.
Your name is?
My name is Clement. Can you hear me?
Yeah, I can hear you.
Hello, can you hear me?
I can hear you. Go ahead.
Wow.
Or maybe you try calling back. Maybe the network is bad. It has been happening all day. Calls have been coming and cutting. So, Doc, you said that happened in 2020.
Okay, that happened in 2020.
In the year of the COVID.
COVID. Okay.
So I had that issue. You're telling me that if I get injured again, I don't have to get a tetanus shot this year?
Yes. Because that vaccine was a vaccine you had, so it is expected that it would last for 10 years.
10 years. Okay. Hello?
Hello.
Yes, good morning. Good morning. Your name and location, please.
Yeah, my name is Clement Ezel. EZEF.
Okay, Clement Ezel.
Right. I want to ask the doctor. Is he listening?
He's listening.
Okay. I wanted to ask him. So, in a case where somebody has just taken, or maybe has taken a vaccine as a kid, is there any likelihood that virus or whatever when it gets older? That's what I want to know.
Can you ask that question again? You were cut short for a few seconds.
I think I got.
Sorry?
I think I got him.
Okay, all right.
Okay, he's asking if an individual has gotten the vaccine at childhood. Is there any possibility that when that person gets older, the vaccine is still active?
Okay.
Okay. The answer is no. Once you get the vaccine at 10, at birth,
Yes.
so after 10 years, it's expected that the vaccine would have won. You take another one every 10 years. For your tetanus vaccine, we have DPTA. So an individual is expected to take that vaccine, a booster. We call it a booster dose.
Okay.
An adult is expected to take a booster dose at every 10 years. So
in 2030, I'm to take another one.
yes. So, however, depending on what you were given, if it was a vaccine they were given, then some people will just give an immunoglobulin. Are you getting it?
How will I know the one I was given? Because I have no idea. They told me they're giving me a tetanus shot.
Yes. So most time what they give is immunoglobulin, TIG. Are you getting it?
Okay.
So an IgM, a tetanus IgM. So we advise people at every 10 years they get shots.
So you said unless you're given an immunoglobulin, not a booster shot.
Yes.
How would I know? Is there any test for it?
No, you have to go to the hospital. The doctor that will explain that to you.
Okay. Whew. That is something, because I'm sure I've taken this because I told you I took a tetanus shot before, and then I took another one in
Well,
2020
Yes,
when I
so
had that
it-
injury.
yes, I think by convention, possibly they would have given you the vaccine.
Okay.
Then are you getting it?
So if I had taken the vaccine, you know, a lot of people, whenever they get injured, every time they get injured, they get a tetanus shot. It happens anytime, even those kids I told you about.
Yes.
So is there any complications for that? You know,
No.
there's no problem.
No complication.
Okay. So is there any specific
Predisposition to what could lead to, if you have wound,
Mm.
it's play and all that. So at that juvenile age, at risk, people don't really keep to vaccine. So we are mostly at risk of getting.
with this one? So when we're kids, we'd put a knife on the stove and put hot oil. Tetanus shot.
It does not.
Okay. Okay. Okay, go ahead.
It does not. It does not. It was a traditional way. However, it worked for them.
It worked for them, but it didn't replace.
Yes,
it's just that they were not infected.
Most of them were maybe actually they were not infected with tetanus.
So you see,
Because
okay, you said
not everybody that marched on the nail.
blood to the bloodstream. If they put that hot knife and oil on the leg there, don't you think it's going to tackle the tetanus?
No, it's not going to tackle it.
Okay,
Because that knife does not contain the immunoglobulin
that is needed.
that is needed.
Okay, mothers, please just go and get necessary treatment. Stop punishing your kids. That was terrible. I'm laughing because I can get flashbacks. I avoided getting injured because of I didn't want to get that kind of treatment.
Exactly.
It's terrible. Another myth is if you have a puncture wound bleeds a lot, then you don't have to get a tetanus shot because the blood has brought out.
Once the spore of the tetanus
Yeah.
of the Clostridium tetani enters through the blood, it sits in, and that's how you get it. It doesn't mean how we bled or something.
Okay.
Even if they do banding on the nerve cells.
So it has nothing to do with blood anymore.
No.
Okay. Next myth. This one says a tetanus shot won't help after you said there's an incubation period for tetanus.
Yes.
Is there any time that it will be useless taking a tetanus shot?
You have gotten the disease.
Mm-hmm.
During the treatment, you still give them the shot because it slows down the clinical symptom.
Okay.
It helps
At
them to
any stage.
It helps them to heal faster
Okay.
or to recover faster.
Okay. Another one, because this one now I think we have established this in one way or the other. You can only get tetanus from a rusty nail or from a broken bottle.
No. Broken bottle, you get it. But if they are not on the broken bottle, you not get it. And you can still get it from other sources.
Yeah, I remember one time someone was pierced with a wood, and they were told go spa.
In fact, you could just have an accident and that wound was not properly treated.
Treated.
It could flow. The spore could flow from the end and enter the wound.
Okay, I hope you're listening though and debunking all these myths, because I think we're going to make it a regular thing. Every topic we treat, we're
Yes.
going to be debunking some myths. All right, so this one says that there are some ways that you can prevent tetanus without using possible.
Yes, the only way you can prevent it is one, properly. If you have a wound, not predisposing yourself to injuries, injurious agents.
Okay.
So, but if there is any other thing they think that could flow from the air that will prevent it, provided you avoid injurious agents or circumstance. Yes, flooding.
How so?
Yes, because when we are talking about the sources, we talked about it is prevalent
In damp
in
areas?
damp areas,
Okay.
hot environment. So flooding could get the spore or could make this bacteria, because bacteria are found in dirty environments. So why it's common in Africa is because we have a very poor environmental sanitation, especially in Lagos. If you are in Lagos, if you have a wound, there's possibility that if you live in some part of the possibility that you may have tetanus.
So this now just flew into my head. Since you're talking about dirty environment, you're saying, and talking about flooding, damp areas, and stagnant water and all that, is it possible for any of those insects that thrive in these areas to, send it to you?
Of course.
What?
Of course. Because we talked about less common sources, causes, insect bites.
So mosquitoes can send tetanus into my stream. Wow.
If mosquito carries the spore, it can give you. Mosquito is an insect, yes.
That is wild.
Are you getting it? So,
Yeah.
so if you have a chronic wound and an insect moves on it, or insect bites it, there's some insect that bites and give you wound.
Okay.
That's why you see some people, they tell you, I was bitten by an insect
Okay.
on my leg or somewhere before you know the wound started.
Berlin, and you wonder what's the problem?
Yeah, you see, it's another insect. Are you getting it? So,
Yes.
if such could happen, it means insect can give it, but they're less common cause.
Yeah, let's come on, because it
source.
happens.
It happens.
Before we go, let me just ask you this question. You've said it, but I really need you to say it again. You said when you get vaccinated as a kid, between 0 and 10 years,
Yes.
you're good,
You're
right?
good, yes.
Every 10 years you have to get booster shots.
Booster shot.
While I've gotten that booster shot, the way I told you I had
yes,
one,
yes.
and you said it's good for that 10
Yes,
years. Is it possible for me to still get tetanus? Is there any rare case where I can still get tetanus even after being
It's very rare.
vaccinated?
It's very, very rare.
But it's possible.
But it's possible. Of course, some people, even with vaccines, I've seen some people that have had vaccines for a disease and still get the disease. Are you getting it? So some
okay.
people may have vaccines and wins faster in their system. Like something like hepatitis B. You see people that say, I'm completely vaccinated. But it still happens.
All right. Thank you very much, Doc, for shedding the light on this, because I'm really enlightened.
Thank you.
I have known things I didn't know before. And before we go, I just want to say this, okay? There are many things that we don't buy. You have not gone to price it. You have not gone to ask for how much it is.
Yeah.
You just rule it out because you say it's expensive.
Expensive.
Have you ever gone to a supermarket and you're like, this thing let me even see how much.
Yes.
And then you're like, oh my gosh, this is really cheap.
Yes.
So that is the same thing that we have in our head.
Of diseases cheaper and better than cure.
Exactly.
So when you get yourself checked, get your necessary vaccines and do that, you live healthy.
It is 98.3 million FM, the sound of Lagos. You can still get what we just said right here in 3FM. My name is Lillian. I'm very kind. Thank you very much, Doc, for joining us today. I hope you'll come next week.
Thank you very much.
All right. Health Buzz happens every okay. Thank you. Up next is Still on the Matter with Timmy Timms and Alexandra. So you have to stay tuned to listen to what's happening right now in Nigeria.